Hello, welcome back to the Afternoon Agenda here on GB News with me, Alex Phillips. Now, cholesterol, a word people automatically see and associate with ill health. It's a fatty substance found in your blood. For years, we've been told to eat things that lower cholesterol levels in our bodies and avoid foods that contain high levels of it. But recently, we've learned that there is good cholesterol and bad cholesterol. So, what is the truth? Joining me now in the studio is Dr. Aseem Malhotra, consultant cardiologist and chair of public health collaboration. Aseem, lovely to have you back. First of all, to give us an overview about public health collaboration, because this is a wholly newly formed organisation.
Yes, Alex. So the public health collaboration is a registered charity. We've been sort of working behind the scenes for a few years, growing a grassroots movement, a grassroots army, if you like. Made up of now about 200 healthcare professionals, including doctors, nurses, dietitians, nutritionists, health coaches, pharmacists, and 300 ambassadors, which also include members of the public and patients. So it's about 50% patients and members of the public, and 50% are people within healthcare. And the aim of the organisation ultimately is to campaign on trying to clean up really the pandemic of medical and health misinformation that's out there. So we are trying to clean up this medical and health misinformation mess, which causes a lot of harm to people. You know, the two biggest culprits, if you like, driving that, the two biggest industries are the food industry and the pharmaceutical industry. So we want to give people clean information. And also some of the, you know, we've been doing a lot of work for the last few years. So my vice chair that you may know, Dr. David Unwin, is a pioneering GP who's managed to reverse type 2 diabetes in about 100 of his patients, 50% of the patients that he's actually tried to manage in his own practice, just from a low-carb, real food approach. That's it, which is pretty extraordinary work that he's been doing. A health coach called Lou Walker recently published a paper in BMJ Nutrition where during lockdown, Alex, interestingly, where we know most people actually gained weight, she, with a number of public health collaboration ambassadors, through Zoom consultations through something called the Lifestyle Club, were able to help people lose significant amounts of weight and even improve their mental health. So that's now being piloted across the NHS. And then I must mention, of course, the founder of the Public Health Collaboration, who started this all off, is a former personal trainer, now become a very good friend of mine, Sam Feltham. And he's the one that started this a few years ago, got people together, and now really we need to campaign on these issues because, as you know, our NHS is under so much stress and pressure, there's so much chronic disease. And the problem why many other charities or medical leadership haven't sorted this out is because there's too many links to vested powerful interests. The pharmaceutical industry, for example, and the food industry, you know, are linked to many people who are kind of leaders in this space, if you like. And that, I think, stops or inhibits them actually being completely honest with the public and campaigning to tackle their misinformation. So that's what we plan to do over the next few years. And a few campaigning topics, just you know, for people to be aware of, you know, things like improving medical education when it comes to lifestyle. 80% of doctors know nothing about nutrition, the impact of nutrition on health, which you might find quite shocking, but it's because we don't learn about it in medical school. You know, tackling issues about ultra-processed food consumption, you know, really taking lessons from tobacco, things like taxing, you know, ultra-processed food, raising awareness about those sorts of foods, and even things like, you know, improving the hospital food environment. 75% of food purchased in hospitals is deemed unhealthy now. I mean, it's extraordinary, you know, so there's a lot of work to be done, and I think that we are the charity to do it. And I think what makes us stand out from other charities is we take no corporate sponsorship. This is funded by the public, for the public.
So sticking with the idea of lifestyle medicine and food in particular, let's talk cholesterol, because it's a word that we've all heard of. I know plenty of people who are on medicines for high cholesterol. And for, I mean, I remember all the adverts from the 90s about eating things to lower cholesterol, all told to have margarine and various things like that. Avoid fat, basically, was the message. If you want to lower your cholesterol, do not touch the whole milk, do not have the double cream. Was that wrong messaging?
Absolutely, yes. Completely, totally, and utterly wrong. So the 3 to 4 decade campaign, if you like, to lower cholesterol in order to combat heart disease has failed. And the reason it's failed is because the original science behind it was flawed. And just to give you some context, Alex, one of the founders of the evidence-based medicine movement, Professor David Sackett, actually said 50% of what you learn in medical school will turn out to be either outdated or dead wrong within 5 years of your graduation. The trouble is nobody can tell you which half, so you have to learn on your own. So for the last 10 years, I have been doing a deep dive research into the whole issue of cholesterol and statins, which are cholesterol-lowering drugs, to see what the true impact has been on this, in curbing heart disease. And it's actually not helped. In some ways, it may have made the situation worse, because the original data around lowering cholesterol was based upon a very small number of people, 1 in 250 people, having genetically very high levels of cholesterol. And there was a strong association in those patients and those people in having premature heart disease. But for everybody else, it didn't really make much difference. And then over the years, lots of trials have been done to see, does lowering cholesterol, even bad cholesterol, have any impact on reducing heart attacks and strokes and death? And when you look at all the evidence, and something I published on last year, there is no correlation. So in essence, for the overwhelming majority of people, lowering cholesterol for the purposes of preventing heart disease is a complete waste of time. And if you, in that process, Alex, are eating high sugar and high refined carbohydrate foods to do that, you're probably actually making your health worse and increasing your risk of heart disease.
So in terms of good cholesterol, bad cholesterol, what should we be eating? What shouldn't we be eating? I mean, this is going to be very confusing for a lot of people, because there must be lots of viewers out there who are on statins, who take statins regularly, who've been told absolutely black and white by their doctors, no, you need to be on this. You need to be on this because your health indicators are not good. And you're saying, no, that's wrong.
Well, not completely. So I think there's two different discussions here. One is about lowering cholesterol for the sake of lowering cholesterol, either through diet or drugs in general. And we know that doesn't really have much of an effect. Now, statins do have an effect. But as I write about in the book, A Statin-Free Life, which I just published, the effect of statins is likely nothing to do with lowering cholesterol. They also have the properties of being anti-inflammatory and anti-clotting. But even when you break that down, Alex, the actual effect is very, very small, much smaller than what people are told or what they realize, much smaller than even most doctors and general practitioners probably realize as well. So just to give you some context here, if you've had a heart attack or you have heart disease, then a statin, taking it religiously over 5 years, if you completely trust the industry-sponsored data, because that's the other problem, all of this data comes from drug company-sponsored trials, but let's just say that we accept that as gospel truth, then the absolute benefit for an individual is 1 in 83. So 1 in 83 of those people who've had a heart attack will have their death delayed, or it will save their life.